Hi everybody, we have a very exciting show today. For those of you who don't know me, my name is Darnell Cox. I'm a gerontologist and a healthy aging coach. I have a very exciting Instagram live today. We are talking with Dr. Jenell Decker. We are talking about menopause, hormone replacement therapy, and gaslighting of women's health. So big show. We had some technical difficulty in the beginning, but we're back on track. So I thank you all for sticking with me on this very, very important topic. So let me see if I can get her on here right now. Let's see if she's joined. You guys, hi, for craft's sake, again. Hello again for all of you that are joining me again. Yeah, we had a little bit of a late start here because we were trying to get Dr. Decker on here for this very, very important topic. So I'm going to see if I can try to grab her right now. We did have some pretty major technical difficulties. It would not phone call, figured out what was wrong. So Dr. Decker, I'm going to invite you right now, and we'll see if we can get you on here. As a side note, you guys, we do have a giveaway today. So this is by WELLCORE. This is the female assessment kit. It retails for $199. It is a hormone optimization kit, and it's an easy at-home blood collection using their revolutionary tap device that involves no needles, finger pricks, and is practically painless. So you can test 26 different biomarkers at home: estrogen, progesterone, testosterone, thyroid, etc., that were once only available in a lab. So now you can test it at home. This is what's up for grabs today. When I post this to my main feed, what you will do is you will make sure you're following WELLCORE, make sure you're following Live Young, and you tag your 3 people, and then the winner will be announced next week. So that's what's up for grabs. I invited her, but let's see. Yes, view request, go live. Yes, okay. Without further ado, you guys. Oh, does that company ship to Canada? I will find out. Here is Dr. Decker. Welcome, Dr. Decker. Yay, we did it.
Can you guys see me?
We can see you.
Oh, thank goodness. Yay! I'm so happy to be here.
I'm so happy that you were here. This has been a long-awaited topic. I've had other guests on here talking about menopause, but you guys, let me introduce you to Dr. Decker. Tell us a little bit about yourself, because you've got your own story when it comes to addressing your own menopause. And if a doctor, here is the part that is like, if a doctor is having trouble getting help for their own symptoms of menopause, we have got some serious problems, folks, right? Okay, Dr. Decker, tell me your story.
All right. Well, I am 56 and I have been out practicing in medicine. I graduated high school in 1996. So I've been at this for a while. So I have seen quite a bit to occur over the years. I mean, whenever I first got out of medical school, we were putting women on hormones left and right, because in 1995, a study came out called the PEPI study, which looked at cardiovascular health and was good for women. And then, as you know, in 2002, the World Health Initiative study came out, and we started jerking all the women off of hormones and
I want to just interrupt you for a second, Dr. Decker. For those of you who don't know about that study, the Women's Health Initiative, they took postmenopausal women. They were using synthetic hormones.
Exactly.
So there was a lot of, and since that study has been retracted, right? So, but we're still living under the shadow of this inaccurate study that showed an increase in breast cancer and other health concerns when putting postmenopausal women on synthetic hormones. That's not what we're doing today.
No, no, it is not at all. And then, so part of my journey has been, I'll be honest, whenever I got out of medical school and residency, I was very much in shape. I used to rock climb all the time. I got married. It was an unhealthy marriage, so I gained a lot of weight, and I went from a BMI of 22 to a BMI of 27, not 27, 37. So, and I finally started making the lifestyle changes that I needed to make, and I started losing weight, and I lost like 30 pounds, and then I plateaued, and I was like, well, what's going on? I'm doing everything I tell my patients to do. I'm eating right, I'm exercising, but I'm not dropping any more weight. And that's whenever it's like, oh,
Yeah.
ding, 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 ding. This is hormones, I'm perimenopause, and this is all hormone related. I mean, I was having the typical symptoms, hot flashes, night sweats. I went on a lot. I went on phenylfaxine, brain fog, definitely. Went on phenylfaxine to help with some of my symptoms, but it was kind of like, well, I don't want to be on this the rest of my life. And so I had went and saw a physician about the pellets. I actually did the pellets for 6 months. I didn't like the pellets that well, but I did notice a difference in myself. And so I started seeing another physician, but not my primary care doctor that I was seeing for my own health. No, there was no discussion of, treating my perimenopausal symptoms. There was no treating, after replacing my hormones after I went through menopause. And so, and there's still very, very much a misconception out there about hormones and that they're negative. I mean, as a matter of fact, if you look at what we call the physician desk reference, it has black box warnings for estrogen that we have to tell, even though there's a difference between conjugated equine estrogen, and there's a difference between estradiol, which is our natural estrogen. And so a lot of times you'll hear me talk about estradiol and then it's kind of the same thing with progesterone. Progesterone isn't talked about very much. And there's a big difference between progestins, which is the synthetics that, can cause some negative things, and versus the micronized progesterone, which is our natural progesterone. So it was not easy getting on hormones myself. So I actually had to travel 90 minutes away from where I currently live to be able to get on hormones.
That's to me, that's like insanity, because we were born with all of these hormones. So
Correct.
It's kind of interesting to think like all of these hormones have been in our bodies this whole time. We're talking about, Shimra just asked, what are we talking about? We're talking about menopause. We're talking about hormone replacement therapy. We're talking about gaslighting of women's health to try to find help and try to find relief from the symptoms of estrogen deficiency, which, as we've learned from my other guests that we were on here, estrogen deficiency, when your estrogen drops during menopause, it leaves you susceptible to age-related diseases such as Alzheimer's disease, heart attacks, and osteoporosis.
Right.
So estrogen works to literally protect our bodies from age-related diseases. We're living much longer than we ever have. Yet it's so difficult to get on hormone replacement therapy because there's not the education that we would hope for taking care of women in this country, right?
Yes. We are still, there is a generation of women that has had a major disservice to them because of the World Health Initiative that came out in 2002. And even now, the current recommendations is the lowest possible dose of your hormones for the shortest amount of time. And that's like, okay, show me the study where there's some benefits in that. There's no study out there that's going to tell you that. And this is all a CYA, cover your behind, because of because of that study, that poorly done study that came out in 2002. I mean, I never thought anything about prescribing hormones, and we were doing the Prempra, we were doing the, the synthetics, prior to 2002. I never once thought anything that I was doing any
Yeah.
harm to patients, and looking back on it, I wasn't doing any
No.
harm, but the World Health Initiative tried to say that yes, we were doing harm. So I mean,
There is a very, very, very small percentage of women,
mm-hmm,
small percentage of women that have
mm-hmm,
a certain gene that predisposes them to breast cancer
right,
that is
and those,
estrogen dependent.
yeah,
It's a very, very, very small amount of women.
yeah,
But let me just say this, and this is what I learned from Dr. Barbara Taylor, who is also was a retired OBGYN who
right,
deals with menopause. Um, Far more women will die of heart attack
yes,
during
it's
menopause than will have breast cancer, because it's a small amount, teeny tiny. If breast cancer runs in your family, you've had the genetic testing. There are certain types, only small amounts, certain types of
right,
breast cancer that will be made worse with estrogen.
mm-hmm,
Um, but
mm-hmm,
that is a very small amount. Way more women are going to die of heart attack or have
mm-hmm,
osteoporosis or have Alzheimer's from being estrogen deficient. So
right,
it's really such a shame that this study has really put women's health in jeopardy since 2002.
yes, since 2002. I mean, I was a part of the primary care physicians who were taking their own patients, taking their patients off of it, and looking back, I mean, it was such a major disservice. And even now, I mean, we're not taught this stuff in
No.
medical school. We are not taught about hormones, and if you look at the guidelines, I mean, it's there's nothing behind it. It has nothing to do with your health. I did watch your live with Dr. Barbie Taylor, and I absolutely loved it and agreed with everything. I mean, because if a woman develops osteoporosis, your primary will probably try to put you on what's called a bisphosphonate, which is like Fosamax. And there's a whole host of problems with Fosamax, of where you have to take it. It can cause esophagitis. It can cause some serious, serious problems with what's called osteonecrosis of the jaw. Not any really good studies, that say that it helps to prevent osteoporosis to begin with. Whereas you look at estradiol, and estradiol is the best out there for
Yeah.
treating osteoporosis. And,
Yeah.
if you break a hip, whether you are a man or a woman, you are at a 15%, don't hold me to the exact numbers, as far as like increase in mortality and morbidity. So, I mean, that's a lot.
For
And,
sure.
yeah, and then the other thing that's never talked about, it's starting to come forward, talking about lipoprotein A, and what that number is, and whether or not you're at increased risk of cardiovascular. Currently, there's no drugs out there that affect lipoprotein A except for estradiol. That's the only thing that will actually help lower your lipoprotein A. And so, there's a lot of misinformation out there.
So much,
And
yeah, so much misinformation. Well, I think there's a couple issues, I think, with the whole. First of all, the 2002 study really kind of screwed women.
yes,
And so now it's really difficult for people to get help. Even though somebody that I follow on Instagram, a man who is like a leading functional medicine doctor, I heard him
mm-hmm,
the other day on a podcast say, we recommend, talk to your doctor, see if it's right, if hormone replacement therapy is right for you, but we always recommend the lowest dose for the shortest amount of time. And I just thought, if he were talking about cardiovascular health or bone density, he would not be saying we recommend the smallest amount of dose for the shortest amount
Right.
of time.
Right.
How long do you want to have strong bones? How long do you want to go without? How long do you want to go protecting your heart?
I mean,
this is not something that you need to wean off of. It's
no.
not like you just have hot flashes. Menopause, as we know, is more than hot
Yeah.
flashes.
I
Night
mean,
sweat.
and there's a couple other things that I do want to mention here that we are taught to do in medical school. Like if a woman has a hysterectomy, normally your primary or your OB-GYN will just put you on estradiol because you no longer have the uterus, and you know you don't have to worry about shedding the lining, and you don't have to worry about uterine cancer. But there's benefit to women still being on progesterone after a hysterectomy, and part of that is it helps to prevent breast cancer. It helps with your night sweats. It helps with your sleep. I love
Yeah,
my
because
progesterone. It's like, don't
estrogen is
take
like
it
up,
away from me.
but
What's that?
progesterone kind of is. Progesterone is when I take progesterone. So here's my hormone replacement. This is, and everybody has different forms. Okay. But and it's not just estrogen, like we were talking about, that decreases with age. It's progesterone,
Mm-hmm.
testosterone, DHEA, your thyroid gets affected. There's a lot of shit going on here.
Yeah.
But
Mm-hmm.
when I take
the reason why we get that middle-age spread is because our hormones aren't optimized to what they were when we were in our 20s. And
exactly.
you know, I plan on living a long time, so you know, it's just the way it is. I'm going to have to replace my hormones. And the one thing I've noticed with functional medicine physicians, functional medicine, don't get me wrong, I love functional medicine. They're all about the root cause, but the root cause to a woman's estrogen and progesterone and testosterone deficiency is their ovaries atrophy after a while.
Yeah.
I mean, and can you fix some things with diet and exercise? Yes, but you're always going to need it. I mean, it's not something I myself am. I'm on estradiol, I'm on progesterone, micronized progesterone, I'm on testosterone, and I'm on thyroid. And if my colleagues that are traditionally trained looked at my thyroid levels, they'd be like, why are you on thyroid? You don't need thyroid. And I was like, no, that's the one thing I love about WELLCORE is that they are all inclusive. They follow the World Link Medical's guidelines, and part of that also includes thyroid, because one of the things that happens is that as we get older, the pituitary gland in our brain sends TSH, our thyroid hormone, to our thyroid to stimulate the thyroid to make T4, and then out in the periphery, the T4 is converted over to T3. And it's at the cellular level that the T3 is active, and we can't measure inside a cell. I mean, it's kind of like we were talking about progesterone. Progesterone affects, it's neuroprotective. These hormones affect everything. Everywhere. And so, as we get older, the enzyme that converts over from T4 to T3, it doesn't function as well. And then our receptors get to where they are kind of resistant. Everybody's heard of insulin resistant, but nobody ever talks about thyroid resistance out there. And so, our thyroid, our T3 receptors aren't picking up as well either. So, that's another reason why we get the mid-age spread. And, we're taught
the mid-age spread. By what Dr. Decker means is the mid-age spread. Like we get bigger with midlife, and a lot of that has to do with our decreases in hormones. And our thyroid is our master gland. It's in charge of all the different hormones. So when you go and get your tests done, your hormone tests done, which I recommend anybody over the age of 35. What is your thought on that?
No, I think over the age of 35 is a good good guideline, because it's usually around the age of 40 that it truly starts to not function as well.
It just goes like this.
Yeah,
I describe my menopause symptoms as like I was fine one day, and then I fell off.
And let's not forget about the anxiety, the stress and the emotions. I remember being at work going to myself like, I was just so aggravated and frustrated. And I was going into the mailroom and I'm like, what is wrong with me?
Yeah.
And then it hit me. It's like, oh, I'm
Yeah.
perimenopausal. That's part of the
Yeah.
problem. And
The
yeah,
first day when I had my, when I started my hot flashes, I like, you can explain a hot flash to somebody, but
but
until
until you
you
have
have
it.
one, if you have bad hot flashes, which I had bad hot flashes before I got on my hormones, I had bad hot flashes, and I'm 55. So
Mhm.
I think mine started in my late 40s when I started having the symptoms. Now, the symptoms started way before then. I did have 3 children. I nursed for each of them for a year. I didn't ovulate the whole time I nursed. So that pushed when you have children and you nurse, it pushes your menopause out a little bit, right? Because you're not
Right.
ovulating during nursing. So I went through menopause a couple years later than my same aged friends. But when those hot flashes hit, it was like, it's a heat you can't explain. It's like
Mhm.
a furnace coming from inside.
Right. Yeah.
And I was miserable, non-functioning, miserable, night sweats,
Mhm.
brain fog, couldn't sleep, insomnia, dry skin, itchy scalp. Listen, if you're in midlife and you have a symptom that you've never had before, it's probably a hormonal shift,
Mhm.
right?
Yeah. Yeah.
It's probably
Yeah.
a hormone. So I got a lot of questions here. So Not Afraid of 50 said, I just went and got blood work and was told it looks good and was absolutely told nothing. No night sweats, no hot flashes. In between menstrual, I cry easily, even more tender. So you were told that everything looks normal, Not Afraid of 50, but you're the one experiencing the symptoms. Dr. Decker, what do you have to, I have my own personal opinion about this, but what do you have to say about that? If a doctor
Well, I
says
want to
everything
ask
looks normal.
who, normal for who? Is it normal for you or is it normal for somebody else? And I say you treat the patient and not the labs. And when we're in medical school, we're taught, oh, you treat the patient, not the labs. Well, as soon as we get out, that's what we start doing. We start treating the labs and not the patient. And so yeah, no, I mean, it's like normal for who? Who's it normal for? And I
That's
apologize.
kind of why I always suggest, and I'm not the doctor here, but when I work with clients one-on-one and my clients are over the age of 35, I always say, go get your hormones test, because even if you aren't in perimenopause, your hormones in your mid-30s are still shifting. And to get a
Yes.
baseline of what that looks like,
Mhm.
because Not Afraid of 50, if you know your doctor's saying this looks normal, Dr. Decker saying, to who? Does it look
Normal
normal to
for
how you
who?
were when you were in your 30s? Probably
Or in your
not.
20s. I
Right.
mean, I want my thyroid to be at when I was in my 20s, and I know that it was like less than 2. And here's the other thing. I mean, the thyroid, the TSH, it's not a good measurement of our thyroid functioning. I mean, T4 and T3 is a little bit better, but then a lot of times when we order the blood work, we'll just order the TSH and tell it to reflex to the T4 and T3. Well, all of that needs to be checked, and you need to be looking at your symptoms, and are you having an underfunctioning thyroid symptoms?
Yeah.
And if you are, then yes, you should be supplemented with. And the other thing, you should be supplemented with the desiccated thyroid, which has T4 and T3 in it. And then a lot of times we'll say, and this is a World Link Medical teaching, which WELLCORE follows, and that's part of the reason why I love working with them, is that they believe in the World Link Medical protocols.
Yeah.
And is that, you know, a little bit of T3 at around 2 o'clock, because we all start to kind of get that, you know, early afternoon slump after we've had lunch and so forth. And so, but yeah, I want my levels to be at like when I was in my 20s, because in our 20s, that's when we're the healthiest. That's when we have the least amount of insulin resistance. That when we have the least cancers. So yeah, I mean,
I aim to have my skin function. Tomorrow, you guys, I'm microneedling my whole face live.
I myself love radio frequency microneedling, and you know, and that brings up a good thing. I mean, a good point is that estrogen, estradiol, and testosterone, they're fabulous for the skin. I mean, they help to build collagen. I mean, you know, boost your collagen and elastin. So, you know, if you're internal
the moisture of everything. When your estrogen dips, you'll notice that your skin is dry.
Yeah.
You'll notice that your vaginal region is drier. Like everything, your eyes are drier. Things just dry out with estrogen.
Yes, urinary incontinence. And here's the thing. I mean, we can treat urinary incontinence with estradiol. I mean, though it does have to be the cream and the testosterone cream. And, you know, we can treat urinary incontinence with those hormones. And, you know, I don't know about everybody else, but I would rather have those hormones. And there's a little bit of difference between oral estradiol and the creams. You know, studies have shown that the oral is the better one to help with the cardiovascular protection. And that's the reason why I always like to try and put women on the orals. And if they're having some of the problems with the urinary incontinence or severe vaginal dryness or painful sex, then, you know, consider supplementing a little bit with the estradiol. And so
I do all of it.
The cream.
I hit all of it. You know, I do.
Yeah.
I do my DHEA cream in the morning and the evening. I have testosterone cream that I do in the morning and the evening. I do a bias, like an estrogen that I do sublingually under the tongue. I do these drops, and I have progesterone that I use at night. And
I love all of those. I mean, you know, and you've brought it up. There are certain patients that, you know, aren't good candidates for optimizing hormones. I mean, for example, blood clots. I mean, if you are prone to blood clots or have had blood clots, then you probably shouldn't be on the hormones, but you can be on thyroid. I mean, you would feel better with that. And but yeah, I love all of mine, and my testosterone levels are supra-therapeutic, meaning they are much higher than what you would expect in a female patient. And part of the reason why I do that, and this is never talked about, this is not something we're taught. I mean, even though if you go and you look and you'll see, but there's about 30% of the women out there that when they go on birth control pills, their libido tanks. And it has to do with the sex-binding globulin hormone. And I'm one of those 30% women that as my estradiol level goes up, my SHBG changes, and then my libido goes down. So I counteract it with a higher testosterone level. And, you know, I'm not going to masculinize unless I'm doing an estrogen blocker.
Right.
So there's no worries or concerns about me, you know, all of a sudden, you know, getting facial hair and that sort of thing.
Right. Yeah. Well, I think that a lot of women don't realize we actually have more testosterone in our bodies naturally than we do estrogen. We've had it our whole lives. So there's nothing to be afraid of. When your testosterone drops, you're going to start losing some muscle mass as well, which then everything is connected, right? It becomes like this snowball effect. Your testosterone drops, your muscle mass drops, sarcopenia, where fat starts infiltrating the muscle. It's super hard to lose weight after that. Your metabolic, like it's one thing after another that starts with hormonal balance. If your hormones aren't balanced, especially as for women, we're looking at an increased risk of osteoporosis. We're looking at an increased risk of Alzheimer's and dementia, an increased risk of heart attack, dry skin, loss of libido. I mean, you know, that's the other stuff, you know, the dry skin, the losing the hair, that's stuff that we see, but when we can't see into our bones.
No.
We can't see into our heart and say like, okay, we're increasing our risk of heart attack. We're decreasing our bone density, which can cause fractures as we get older. That is another snowball of negative health decline. So hormonal balance, for I believe, and you can correct, is at the forefront of like women's health. Once you get to a certain age, you need all of this in order for everything else to be healthy.
Yes. No, I mean, totally agree. I mean, because you're absolutely right. I mean, you know, our muscles start to waste. The testosterone, you know, by replacing that, I mean, starts to help with that, which increases our metabolism. Obviously, it can increase our libido. And yeah, no, I absolutely
I've got
agree
a
with all
question
that.
here. It says, somebody asked, Emmy_Amelia 2016 said, can you please ask the doctor if you have lots of fibroids in your uterus, can you take HRT?
Yes, you can take HRT.
So the only people that really this would be of detriment if you're one of the small group of people that have the gene that the breast cancer is made worse or increases the likelihood with estrogen.
Right. And if you also have the gene for blood clots.
For blood clots.
So,
okay. And that, so everything should, once you go to a hormone specialist, and is that what you suggest, is going to a hormone specialist? Because if you're having difficult to find one, if you had to drive all that, imagine like everybody else who may not be as proactive about their health because they don't have medical training. Where do you suggest, besides doing a kit at home like WELLCORE, and this is up for grabs, you guys. So after I post the main feed, just make sure that you're following WELLCORE and you tag your 3 people. You're following me, tag your 3 people, and I'll announce the winner. But this is where you can test your hormones at home.
Yes. No, I mean, and that's another, like I said, that's, you know, part of the reason why I love WELLCORE is that you can do all of this at home and, you know, get your hormones optimized. You know, they do, you know, the 40 and above, just so you know, is the age range that WELLCORE has for women. But yeah, and then you can look on, you know, if you don't want to do WELLCORE, I myself, like I said, I love the fact that you can just do it, and it's painless whenever you check your own labs at home. And their program also includes, you know, for the men, it includes the testosterone and clomiphene, and for women, it includes your estradiol, progesterone, and testosterone. So, and which is really nice.
Also test thyroid, doctor?
Yes, it does. Yes. And they do now have a thyroid program on there as well, to which I think is phenomenal, because a lot don't believe in thyroid resistance and underfunctioning thyroid.
Well, we have a question here that says Lisa Pogil. I can't even begin to pronounce it, but it said, should I do a WELLCORE test if I'm on hormone replacement? I'm having trouble losing weight.
Yes, I think so. I mean, if you're, I mean, you know, if you're already on the hormones, then it can tell you, you know, we can tell you whether or not you are optimized. I mean, because, and the other thing I was going to say, if you go to WorldLink Medical and look at their website, you'll find physicians who have gone through and did their certification, and you'll find, you know, those that are closest to you. And but yeah, I mean, you know, you should do the WELLCORE, and we'll be able to tell you whether or not you're optimized, because I can tell you that blood level wise, I mean, the goal is for your estradiol to be up around 100, because that's when you start to get the most cardio protection from it. And it's the same for men. Men also need estradiol. I mean, I know, you know, this is women, but men also need estradiol, and men also need testosterone. The one thing I do want to mention is, you know, if your man's not waking up with a morning erection, he's got low T. Just FYI, that's a little tip.
Okay. That's an
Yeah.
indicator, woman.
Yeah, that's an
Because men need
indicator.
to
If your
get on
man
that.
is not waking up, he's got low T.
Yeah.
So, but yeah, so, you know, and then progesterone, the level for progesterone that it's recommended for women, not for men. There's big debate out there whether or not it's inflammatory to men. But your level should be up around 8. And that's whenever you start to get, you know, the breast cancer protection and everything. So, and that's the one thing I like about WellCore's program is that they do, you know, we check your labs every 3 months, and it's convenient. It's at your home.
Yeah.
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 So
I mean,
yeah.
listen, even me, I'm on top of my blood work. And even sometimes I'm like, I'm a couple months behind, you know,
I
life
know.
happens. And it's just
That's
like,
what I'm like, oh, I need to get my lab work
it's
done.
like sometimes it just, you know, it just gets pushed off a little bit. Just I have a test at home is kind of cool. And I've never come across this before, which is why I wanted to have you on, because I have a lot of clients that are having trouble finding a doctor. So what was the name again of the website that you said that you could go to that has trained functional medicine doctors that can
We're
start
trained hormone doctors. We're not functional
trained
medicine. A little
hormone
different.
doctors?
Trained hormone doctors. It's World Link Medical.
World Link Medical, you guys. I'm going to have that in the description as well. So
And that's where, and yeah, and it was at a conference, and that's how I, you know, found WellCore, and a lot of the a lot of the hormone replacement programs out there aren't based off of World Link. The physician is Dr. Neil Rosier, and you know, he's like made a tremendous difference in my own personal life. And like I said, that's what I like about WellCore is they follow, you know, World Link medical guidelines, and part of the guidelines it has to do with testosterone, because you know the testosterone and estradiol both help with lipid metabolism, getting your cholesterol and everything down where it should be. But yeah, you can go to World Link Medical and look for physicians, you know, trained that have completed their certification.
I love that, because I was having people call their insurance and find out a hormone specialist in their area. And that is that's so much more difficult than what you would think. You'd think like that there'd just be trained people in every city that dealt with hormones, and that's just not the case.
No. I mean, it wasn't until I went and got this training, and it was only after, because I drove 90 minutes to a physician who had been trained in it, and you know, and I remember sitting there in my first class, and I'm like thinking of all these patients that I have done a major disservice to by following traditional medicine, and I'm like, no, I am all about optimizing hormones, and so.
And not afraid of 50. I just want to touch back on what the levels should be, because like Dr. Decker said, there are what are like the universal kind of standard levels, what those are supposed to be, but everybody is different. And if you have to be your own biggest advocate when it comes to your health. And if you are having symptoms, it means you're not on enough bioidentical hormones.
Yeah.
If you're still having hot flashes, if you're having night sweats, if you have brain fog, if you have
you're
a lack of energy,
not sleeping well, then I mean, yeah, I mean, like I said, I love my progesterone. I mean, I'm on 400 milligrams of progesterone at night, and I sleep so good. I'm on 4 milligrams of estradiol to help, you know, with all of the benefits, you know, the cardiovascular protection, the osteoporosis, the brain fog. And I'm on, you know, I'm on 30 milligrams of testosterone a day, and my levels are supra therapeutic. And testosterone helps to, you know, helps increase your metabolism, helps with both testosterone and estradiol help with insulin resistance. And, you know, and I'm on thyroid. And like I said, if, you know, my colleagues would be like, why are you on thyroid? You don't need it. Your TSH is normal. And, you know, and that's where it's like, okay, normal for who? It's
Normal
not
for who,
normal
but
for me.
also the TSH is just using that test by itself is so antiquated.
It is. It
If
is
your
worthless.
yeah, if your hormone doctor is telling you that TSH is the gold standard test, run,
Yes.
run. You're with the wrong
Yes.
doctor.
No. Yeah. Because it's not a good test. It is definitely not a good test. And if your doctor won't put you on T3 as well, then that says something too. Because T3, I mean, T3 makes us feel better. T3 helps with our moods, and that's what is active at the cellular level. It's not T4. It is not T4. And if that enzyme that converts from T4 over to T3 is not functioning as well, or if your receptors have gotten, you know, aren't functioning as well, you're not taking up the T3 as much into your cells. And so, I mean, you know, you really, and there's a lot of endocrinologists out there that will say, oh, if you know, if you need more T3, your body will make it. Well, no, your body doesn't always make it. And you know, and the other thing I want to say,
just like too, I don't mean to interrupt, but like, you know, if you need collagen, your body will make it. Well, we know that our body decreases the amount of collagen by 1 to 3% in our mid-20s. If we think our collagen isn't declining, our thyroid hormones declining, all of our other hormones are declining with age. So this is what we're talking about. It's not just estrogen
yeah,
when we're talking about hormonal health for women. It's estrogen, it's progesterone, it's DHEA, it's testosterone, it's thyroid, it's all of those. And you keep
right.
going and you keep pushing your doctor until your symptoms are
You
gone.
got to be a big advocate for yourself. And, you know, the other thing I do want to mention, and you know, and WellCore does this, you know, as we go on some of these hormones, sometimes their hair can get thinner. I mean, estradiol thickens our hair, but then the testosterone can kind of counteract that. I mean, there's spironolactone is out there that we put women on to help with you know, hair thinning and female pattern balding. So, I mean, we have options out there.
You guys missed my live show that I did on hair loss. After we're done with this show, go to my highlights and you'll see the live shows. I did a full hour on hair loss and how hormones affect hair loss, but also the way that we're converting testosterone to DHT changes with age. And so even if we're getting the right amount of testosterone, the way we're converting it, DHT is not great for your hair.
For the
Testosterone
hair
is great for your
follicles,
hair,
yeah. And the
but DHT
spironolactone,
isn't.
yeah,
So
blocks that. And yeah, and also getting on thyroid, that helps your hair as well. I mean, I have struggled personally with female pattern balding all my life since in my 20s. And it was being put on spironolactone that helped. And spironolactone, I know this isn't about acne, but it's also very good for hormonal acne. And if you are over the age of 25 and you are having problems with acne, it is hormonal acne. So, and you need spironolactone to help. So.
okay, we have a question. What do you take if your thyroid? This person's in Scotland, and the doctors here also know very little about menopause and women's medicine. So she's saying, what do you take for your thyroid if you know that your thyroid is off?
I personally, what I take is MP thyroid, which has, you know, a lot of T4 and a little bit of T3, and then I take T3 at 2 o'clock. But you've got to find you a provider who's willing to think outside of the box and not follow traditional guidelines, which say, oh, all you need is T4. You're going to convert the T4 over to T3. So, you know, or, you know, oh, your thyroid is fine. Your TSH level is fine. You don't need any extra. So you've got to find a physician or providers, clinicians that have been trained in, sorry about that, that have been trained in in hormones. And so, and when we talk about hormones, we're not talking just about our sex hormones, but we're talking about all hormones.
Yeah,
And
all
so,
hormones. Okay, somebody just said, did you say itchy scalp? Is itchy scalp part of one of the symptoms? Because she said ever since I moved into a house in October because of stress, I started itching my scalp day and night like crazy. Could that be a symptom of something?
oh, definitely. It could be I mean, I can't say what it is because there's a big differential diagnosis for itchy scalp. Part of it could be fungal. I mean, part of it could be, just the environment that you're in. Part of it can be stress. But yeah, no, an itchy scalp can definitely
And then
be.
we also have I know my hormones are still not balanced. I don't feel good, losing hair and other things. Don't know what to take and how much. I'm already on estradiol patches. So when somebody, doctor, when somebody is already on hormone replacement, that's okay. A little
I don't know
dog
what she's barking at.
but when somebody is already on hormone replacement and they already know, they still know I'm still not balanced. I still don't feel good. This is where somebody has to be their own advocate and
Yeah.
still go, I'm not on enough. I'm not on enough.
Yeah. I mean, and that's the one thing that's, like I said, nice about WellCore. I mean, is that we look at your, function. I mean, because not only do I, work with WellCore, but I also do my own little clinic because there's nobody around here really doing hormones, and I wanted to be able to offer that. But yeah, so you got to say, something's not right, and still advocate. Quit. Still advocate for yourself. she's a scaredy cat. It's snowing outside, so she's barking at the snow.
Oh, that's so cute. Okay, somebody asked, does she know if WellCore takes health savings credit cards? I don't know what that means, but
I'm pretty certain that WellCore does. I think that they do take a health savings credit card. Don't hold me to it, but I want to say yes that they do.
okay. And then Not Afraid of 50 actually put all of her numbers up here, which I can't find them. Not Afraid of 50. She said, use me for an example if anything stands out. So I'm going to try to find those, but if you can just stick those back up there, that would be amazing. I'm scrolling and scrolling and I can't see them.
I'm not seeing it either.
So maybe she'll put those up there. So you guys, just to recap a little bit on the giveaway. I thought I was done with the giveaways after the holidays because we gave away so much stuff, but we do have this test kit, and I thought I really wanted to make sure that somebody got this, that you guys were aware that there is testing available in the comfort of your own home. Yeah. We're doing the whole I'm trying to think of a tasteful way to say this, but we're doing the colonoscopy checks kind of at home where you're mailing in your own samples.
Colon cancer screening at home, basically.
Yeah. How do I say that in such a way that I'm not saying poop, but you're mailing in your own stuff for the first round of screening for that. When you're doing something like this and you're also doing your testing at home, I'm not sure if WellCore has doctors that then prescribe stuff or if it's just a way, and maybe you know this, doctor, is it just a way for us to check our hormones at home, or there are actual providers in the WellCore family that then provide options?
There is, I mean, whenever you get your labs checked, then you are scheduled and you discuss with a provider and, with a physician, nurse practitioner, PA, what would be the best levels for you. And then they go over the program about, what all is included in their program, because you are followed by clinicians every 3 months and, and getting your labs ordered and everything. Yes.
So everybody, I won't have the link to the WellCore kit down below, but what I'll have is I'll have their website. When I post this to my main feed, I'll have the website as long as the discount link. So you could get this kit, which is normally $199, for $49. I will give one of these away for free. You have to make sure you're following WellCore, you're following me, you tag 3 people to spread the word. But if you want, if you know that you're going to get the kit anyways, you can use the code Darnell Gift 50. You'll get the kit for $49 as opposed to $199. So that's the WellCore, the hormone optimization test kit at home. And then Not Afraid of 50 did put all of her numbers up here. So estradiol 46. Now remember, Not Afraid of 50, it's going to be different for everybody because every body is different, every level is different, and if you're still having symptoms, you're not on enough. But here's what she's on now, doctor. She's on estradiol. Her estradiol says 46. Her FSH is 31.4. TSH, which again we're not going to really hone into, is 1.8, and the latinizing is 23.8. I don't know what any of that means because I base mine.
You have her progesterone level?
Doesn't have,
I mean,
have that on here.
Okay. I mean, you know, right now the one thing that, you know, stands out is that her estradiol, to get more cardio protection, her estradiol level should be up around 100.
Yeah, that I was gonna say that looks like about half of what it should be. Not Afraid of 50 for the estradiol, and I would be curious, as I'm sure the doctor is too, what symptoms are you still having?
Exactly. It is. Yeah. It's based off of a lot of what your symptoms are. Yeah. Treating the patient and not the lab. And then the other thing I want to mention, the thing about, you know, the big difference about bioidentical and the synthetics. I mean, and part of the reason why they get pushed, just so you know, pharmaceutical companies cannot patent a bioidentical hormone. All they can do is patent the delivery system out there. So, yeah, so that's, you know, part of, you know, you may be like, why, you know, why are all of these things out here? And it's like, well, it has, they you know, they want to make money, but they can't patent a hormone, a bioidentical hormone. They can only do it with the delivery system, and so on. It doesn't really have a whole lot. Doesn't have a whole lot to do with your health.
Okay, so somebody else said, okay, I'm 71, closer to 72, and I still use the estradiol patch. Should I do this testing in your opinion?
Yeah. I definitely think so.
Are you talking about is your age 70? I'm assuming you're talking about your estradiol is at 71, closer to 72. Should she still do, and she's using the estradiol patch, should she still do the testing?
Yes, I would still, just because, I mean, if you're on the hormones, I mean, WellCore can, you know, look and tell you if you are on a good amount and if you are optimized based off of your symptoms. And yes, so even if you are on hormones, I mean, yeah, I would still do, you know, the initial, you know, lab kit and yeah.
I would too, because it's interesting. I think it would be interesting to find out, how does your labs in this, when you're doing it at home, compare to labs when you've gone to a place? I mean, and besides that, you guys, when you're doing blood tests, you have to remember you're looking at a screenshot of what happens to be This is interesting. We think that blood work is like, oh, it's just, it shows you everything. It's a screenshot of what is passing through at that particular moment. It's a screenshot, and our hormones on any given day are not stable.
Right.
They fluctuate.
Right. And it doesn't show, I mean, and that screenshot doesn't show what's happening at the cellular level in your cells. I mean, you know, because that's one of the things, you know, I tend to always recommend is magnesium. And, you know, if you check somebody's magnesium level, it's usually normal, but it's usually not normal in the cell. So I tend to always recommend, and vitamin D. You know, we haven't talked much about, you know, supplements, but vitamin D, I mean, you want your levels to be up over 100, I mean, up over 70, and it doesn't become toxic until you're up around 150 will you start to have some symptoms. So, vitamin D, and it's a precursor to a lot of different things out there. And I think I've already mentioned, with the men, if your man's not waking up with a morning erection, he's got low T. Men also get osteoporosis. Testosterone affects bone health and, affect
but it's
the metabolism.
But it is disproportionate compared to women.
Yeah.
There's far more women with bone density issues and osteoporosis because we've depended so much on this. Women, we are amazing creatures. Okay, the fact that we can push another human being out of our body, and we need these bones that kind of, and the joints that kind of accommodate all of that stuff. When we lose our estrogen, which protects our bones, our sarcopenia, we really go downhill quickly with our bone density, as compared to a man who hasn't had that big protection. So it's disproportionate, but yes, men still suffer from fractures and from bone density as well. We have a question here. Is it okay that that Creative Eye Candy says, is it okay that she gets her bioidentical hormones from a compounded pharmacy? What is your take on on getting stuff compounded? Because I have to make sure I'm going to the right pharmacy, but these are compounded.
Yeah, I myself love a compounding pharmacy. And I think it's totally okay. You've just got to make certain that you keep up on getting your lab work, because, the big difference between commercial and compounding is commercial is supposed to be the same, but, and we talk about generics being the same as brand name, but generics can vary between 80 to 120% of what the brand name is. And so, and so it's kind of the same thing with compounding pharmacies. You can have that variation, and a lot of times compounded medication are going to be more inexpensive than what you would get, as far as like a commercial pharmacy. And part of it has to do with the medication, the price of it is based off of the pharmacist's time, the time that it took for them.
And what they're paying for their leasing space.
Right.
I live in Los Angeles, and Los Angeles is composed of lots of different communities. And a doctor in Beverly Hills, a compounding pharmacy in Beverly Hills is going to charge something completely different than one in Encino.
Exactly. Yes. And so, but yeah. Yeah. No, I'm a big proponent. I love compounding pharmacies, and and that does bring up a lot of politics. There's been a lot of push against compounding pharmacies from the pharmaceutical companies because they can make things more affordable. And so just always think about that.
But because there's that variation with the compounded pharmacy, you're not getting that 100% consistency that you would get otherwise. So you just need to do a little bit more. But I've also found with a compounded pharmacy, it's really easy to adjust the levels, right? That you might not be able to adjust the levels so much. So there's good and take in all of it.
Right. For example, like estradiol, the commercially available out there is 0.5, 1, and 2. Well, let's say you need 1.25, then a compounding pharmacy can do that for you, can make 1.25. Whereas if you want to go with the commercial, then you're going to have to do a 1 and a 0.5 and break the 0.5 in half.
Exactly.
So there's a lot more flexibility with a compounding pharmacy.
Okay, so we have a little bit more time and we'll wrap up here, but Not Afraid of 50 says, okay, I need to get this estradiol 46 up to 100 to protect my heart. Where do I start? You got to call your doctor. Am I wrong?
Yeah.
Call the doctor and you need to up it. You need to up it. If you're not symptomatic of anything.
Your advocate, be your own personal advocate. And your doctor's probably going to be like, well, why? And hopefully they will be like, okay, all right, we'll increase it, but yeah, be your own. And you know, there's a lot of and there's an article, a blog article on WellCore site about medical gaslighting, because we haven't even talked about much about that, but I experienced you know, medical gaslighting, gender bias and weight bias whenever I was having neck issues. I wound up having to have 2 neck surgeries, and it took, and because of the gender bias, because of the weight bias, I mean, you know, my surgery was probably delayed for at least a year, and I was becoming more and more miserable, so yeah, I mean, you know, I truly learned the value of advocating for yourself,
Yeah.
and it was not easy, and it's not easy,
Not,
and there's a reason why I stepped off of the treadmill in my own personal clinic, and I don't accept insurance. And part of the reason is because when you accept insurance, you get on the treadmill, and the only way that you can survive is by productivity, the more patients that you see, and then, you know, your quality of care, in my opinion, goes down.
yeah.
And insurance doesn't pay for wellness, and so there's a reason why your doctor is rushing and unfortunately not listening, and it's because they're thinking about getting to the next patient. And it's, you know, our health system is, I
Shitty.
hate to say it.
It's
Yeah, broken.
it's
It's
shitty.
definitely kind of broken.
Yeah,
Yeah.
it is kind of broken, but I do feel that, you know, being a woman, and especially, you know, you and I are both white women. So in terms
Women.
of women, we're already discriminated against. We're already, you know, when you go in to talk to a doctor, if you're talking to a male doctor about hormone replacement therapy, there's a lot of like, it's just a midlife woman, you know, hysteria, all of that.
A lot of
You
eye
come if you're
rolling.
a lot of eye rolling. If you're a woman of color, it's even worse than that.
Yeah.
And so there's a real disservice to women across America of all shapes and sizes and skin color and socioeconomic background.
We're taught that. I mean, because I mean, I was getting discriminated. I mean, not discriminated, but I mean, I was experiencing gender bias and weight bias from other female physicians. So it's not just the male physician. It is,
That's
you know.
not just the male. It's not just the male physicians. That's right.
Mm-hmm.
Okay, so let's kind of recap a little bit. We're ready to like wrap this up. I want to have you back on again because it took us an hour to get on, but once we got rolling, Dr. Decker, there's some really valuable information in here. So just make sure when I post this to my main feed, and I am going to invite you on as a contributor because there's going to be questions that I'm not going to be able, you know, that's not my specialty. And so I want you to be able to answer those questions. So I'm going to invite you on as a contributor when I post this to my main feed. If you guys want to win this home test kit by WellCore, make sure that you're following me, you follow WellCore, follow Dr. Decker, and then you tag your 3 friends so that we can spread the word that there are test kits for hormones at home, and there is more help that is becoming available. Do we have anything else? Is there anything else you'd like to close us with?
Oh, no, I can't. I mean, you know, I can't think of anything other than to say that, you know, the WellCore kit, and I mean, it is a phenomenal giveaway, and you will learn a tremendous amount in the comfort of your home.
Yeah.
And easy. I mean, because I'll be honest, I have done lab work that you can order from Amazon, and you squeeze your finger, and I mean, because it's like, oh God, I'm too busy. I don't want to go to the lab. I'll just do it here in the house. And that's the nice thing about WellCore's kit. I mean, is there's no squeezing your finger to where, you know, it's painful. I mean, you definitely want to be hydrated well, because the more you're hydrated, the easier it is to get the fluids out. And so yeah, no, this is, you know, this is a phenomenal giveaway, and WELLCORE has a lot to offer, a tremendous amount to offer women out there, not only, you know, replacing our hormones with, you know, our sex hormones, but also replacing our thyroid hormones. And then there's also the spironolactone to help with the if you have problems with the female pattern balding, or just hair thinning whenever you get on hormones. You know, they offer that. And then so they offer a lot, and they offer your men a lot too. So I mean, you know, I mean, definitely offer your men a tremendous amount as well.
And you can use the code DarnellGift50 to get the kit for $49. So that's more than half off. Oh, it's half off. It's basically half off. No, it's not. It's a lot more than that, because this price is
actually 75% off.
It's like, are they giving it away for free? It's normally $199. I was thinking it was $99. It's $199, and with Darnell Gift 50, you get the kit for $49. So that's 75% off. That's a big gift. So if you guys do not win that, and I'll be announcing that next Saturday at 11 a.m. You can get it for $49. I will put that in the description. Make sure that you are following Dr. Decker, me, and WELLCORE, that you tag your 3 people, and you will win this kit. But as a recap of everything, and we're going to get off of here, I think that one of the most important things that came from this show is that to be your own advocate is so important when we're talking about women's health, because if Dr. Decker had trouble finding help with her issues, then could you imagine from the rest of us who don't have that same kind of vocabulary to be able to discuss things and be able to know what's going on with our body? So taking your health into your own hands, and with something as simple as testing your hormones at home, and being your own biggest advocate, and not taking no for an answer, making sure that you're not having symptoms, and that all of your levels are optimally to where you're protecting your bones and your brain and your heart. That's a really good way to live young. That's like, it starts there, don't you think?
Yes, I know. Yes, definitely. I think it definitely starts there with advocating for yourself. And, you know, the one thing that I always like to think is, you know, I work for the patients. I don't work for the insurance. And, you know, and if your physician's like, oh, worried because, you know, oh, I'm, you know, just running up, you know, a bill, and, you know, it's not necessary. Well, they should be looking at a differential diagnosis and ruling things out. And it's like, just remember, your doctor works for you. They don't work for the insurance companies.
Exactly. Okay, you guys, I'm going to post this to my feed afterwards. Make sure that you tag your 3 people and you follow everybody. And yes, Creative Eye Candy, that code was Darnell Gift 50 to get the WELLCORE kit for $49. I will see you guys tomorrow, where I will be makeup free again, microneedling my face. You know, you get to see a lot of different things on the show, but I
love microneedling. I actually radio frequency microneedling is what I
awesome. Well, you can join. I'm doing demos every Sunday at 11 a.m. tomorrow. Is like a whole tutorial on microneedling. So thank you so much for all of this valuable information, Dr. Decker, and we will have you back on. Everybody have a great rest of your Saturday, and I'll see you guys tomorrow.
Sounds great. Bye-bye.